Hey there, thanks for clicking. I'd like to invite you to join us with Implant Training Egypt at the British University in Cairo. Our main objective is to get dentists who need more experience in implant dentistry, particularly in the surgical aspect, to go out to the British University in Cairo, or British University in Egypt, which is a fantastic university just to the east of Cairo. And to have an immersive experience training on a number of patients and placing a larger number of implants, usually 8 to 10, but they can be more, and getting as much experience from a team of implant surgeons, including myself. I personally am Ali Abdelatif. I have an MSc in implant dentistry from King's College London, and I have been in the area of implant dentistry for nearly 20 years. I have trained not only at King's College but at multiple other centres worldwide, and I have a practice in the United Kingdom. If you're interested in joining us, please listen to the rest of this video and we will tell you more details about how the course works. The British University in Egypt is a private university, very modern, very new, just to the east of Cairo. It is incredibly well equipped, very well funded, and a university that has strong links with other universities in the United Kingdom. As a result of that, they have incredibly high standards, and in our field, they have a department of dentistry, a faculty of dentistry, with a department of oral surgery, where they have excellent standards in implant dentistry, and a team of oral surgeons who are assisting and helping and teaching implant dentistry alongside our UK team. So ITE, the purpose of the training is two phases. Number one, to get people to have as much surgical experience as possible, to the level of straightforward placement. So if you look at the document training standards in implant dentistry, there are basically two categories. There's straightforward and there's complex or more advanced implant placement. Our basic level course is to get people confident doing straightforward placement, which means assessing your patient, planning the case on CBCT or digitally or analog, and placing your implant with minor GBR, minor bone manipulation if required. The idea is to give the candidate adequate experience in this so that they can then go home and use that experience to start placing back home in the UK or from whatever country you're from. The second phase of the course is the prosthetics phase, and the idea is that you would be invited out. It's not compulsory, but you would be invited out to come back, expose implants, scan implants and restore them with pre-prepared restorations that would have been prepared for you to fit onto the implants that you had placed. The training is provided by myself, Ali. I have a master's degree in implant dentistry and I've been placing implants for nearly 20 years. I've been on numerous courses and I've taught on numerous courses, along with our colleagues in the British University in Egypt, who are professors, lecturers, demonstrators in the Department of Oral Surgery at the BUE. So the course is structured primarily with clinical training in mind. People are coming out for a few days, they're leaving work, family, they're paying a lot of money, so they need to get as much hands-on practical experience as possible. There is a bit of lecturing or a bit of theoretical teaching, but the primary focus is on actually doing implant placements. The first day, we do a run-through of things and we do practical placement on models and a little bit of animal head training. It's obviously it's in Egypt, so usually it's a lamb head or a sheep's head, where you get a little bit of soft tissue training, suturing training, and practical placement on models. It's necessary to do this to make sure that everybody is up to the same level and everybody knows how to use the implants that we are going to be using on that course. Immediately the next day, you would have 1 to 2 patients per day on which you would place however many number of implants is available that day. And then this would run for 3 to 4 days of daily training. The objective being to fulfill a minimum requirement of 8 implants, if not more, and our candidates who have trained with us have done more and have also done more on their second cohort. Usually training stops at 4 p.m. exactly at the university, after which candidates go back to their hotels, and then we spend the evening together, usually going out to look at sites or going to dinner. And there is one day there's no training, where we go out to the pyramids and have a bit of fun with the usual amazing stuff that Egypt has to offer. So it's important to point out that this course is not a modular course or a certificate course or an MSc or diploma in implant dentistry. It's for dentists who already have some prior knowledge or training, who wish to either increase their skill and experience or want to make up numbers, for example. The beauty is that you're immersed in a department with a team of implants dentists who will give you as much of their experience as they possibly can in 3, 4, 5 days' time. So if you already have some knowledge or you've done some theoretical training and you want to increase your physical hands-on skills, then this is the ideal course for you. ITE, coupled with the British University in Egypt, offers one of the highest standards of implant dentistry training worldwide. How do I know this? Because I personally was trained in the United Kingdom at King's College London, Guy's Hospital, and I know the highest standards that can be achieved in implant dentistry training. It's my job to make sure that that works at the British University in Egypt as well. And I'm proud to say that the BUE also offer the exact same standards of implant dentistry training. The faculty are either master's degrees or PhDs, and the facilities are fantastic. So we have CBCT, we have a specialized zone just for the postgraduates. They have all forms of X-ray, they have fantastic labs, and they have scanners, so their standards are brilliant. In addition to that, because it is an academic institution that is achieving a magnificent international status, they're also very hot on maintaining academic level of training by maintaining logbooks and making sure that everything is followed to the highest possible criteria. How qualified you will be after this course to come back and place implants by yourself in the UK depends primarily on yourself. What we can offer is good surgical training. If, however, you have already had some surgical training and you have some theoretical knowledge, and you feel confident after our training to place by yourself, then that's fantastic. And our candidates who have trained with us have placed alone in practice. If, however, you need to, we do provide also mentoring in implant dentistry in the United Kingdom, depending on geographical location. We can't go everywhere all the time, however we do offer you support and backup when you get home. The cost of the training is split over 2 phases. So you've got your surgical course, and we've set the price at the moment at £5,800. And the second phase is at a slightly lower price. The cost covers all the training, the university fees, the materials, the components, the implants, and your accommodation in Egypt, as well as the excursion that we go out to the pyramids. It doesn't cover all the meals and it doesn't cover your flights. So a lot of people ask, why pay thousands and thousands of pounds to train in Egypt? What is the justification for all of this money? What do I get out of it? And the answer is, it's for you to think about it. At the end of the day, postgraduate training worldwide is expensive. I know this because I have been through it myself many times. It's up to you to decide if you'd like to make this investment and what sort of return on investment you might get. A lot of particularly younger dentists, they expect to, they would want to be able to regain the amount of money that they've paid as quickly as possible. And I'm afraid that doesn't always work in that way. You have to think about it in the long term. You have to think about the benefits to your overall skills as a dentist or as a surgeon, how it benefits you not just directly in implant dentistry, but in other areas of dentistry, what level of confidence it gives to you. I cannot be the one to justify the cost of the training to you. However, I think that it is a worthwhile investment.